I was completely struck and knocked down by these deep, intense pains. I have been for countless tests, ultrasounds. I have done it all. Everyone kept saying, "You're fine. You're fine. Everything is fine." Everything is not fine because
That is Calgary's Pam Goldbranson sharing her very real fight with endometriosis, a chronic, often debilitating disease that affects 1 in 10 Canadians.
And she is not alone. From Chrissy Teigen to Emma Roberts to Amy Schumer, more and more celebrities are breaking their silence. And here to help us understand it better, Pam joins us this morning along with Dr. Marjorie Dixon. Good morning to you both. Great to see you all. And Pam, let's start with you because we just saw your video there. You've been having symptoms, we understand, since you were 21. You're now 40. Tell us when you first realized your symptoms and what you were experiencing.
So when I was 21, I moved out to Calgary, and it was very shortly after that I was in the shower and I was just completely wiped down. I knew in that moment that something was severely wrong. So the next day I went to the walk-in clinic, and unfortunately I was told that because I wasn't having pains in that moment, there was nothing they could do for me. So the next month, the pains returned. I went back again, but because in the moment I was again fine, they basically sent me home. I went for test after test for years, and unfortunately, we got nowhere up until very, very recently. I found a group of doctors that have been absolutely wonderful.
Okay. All right. I'm going to bring Dr. Dixon in on this one because now that we know what is going on, what is actually going on inside of Pam's body and anyone who has endometriosis, and why is it so often misdiagnosed?
So endometriosis is tissue that's very like the inside of the uterus, so the endometrial lining, but it's present not inside the uterus, it's elsewhere in the pelvis. So that means on the ovaries, typically, on the outside surface of the uterus, sometimes even on the bowel and the bladder. And the issue with it is the blood has nowhere to go. So it causes inflammation and scarring and bloating and pain. And patients manifest with it sometimes with minimal symptoms, sometimes with bigger symptoms. But the issue is it can mimic other things. So irritable bowel syndrome. Sometimes people can have blood in their urine or blood in their stools. Sometimes it's present with periods. Sometimes it's present through the entire menstrual cycle, through the entire cycle of a month. So people have a hard time to pinpoint and to differentiate what it is. And what's worse is just as she said. So you can have an ultrasound that shows absolutely nothing. You can have blood work that comes back negative. So though the patient is endorsing that they have all of these symptoms, you're doing screening that comes back as nothing. So unless the clinician is really aware of the intricacies of endometriosis, it takes a long time to diagnose, and then it gets misdiagnosed as other things.
All right, talk about the misdiagnosis. Pam, tell us about when you finally got the correct diagnosis and how you felt.
To be very honest, when I first had that doctor tell me that that's exactly what it was, I felt a lot of feelings. I knew I've been telling people for years and years that that's what I believed it was. So to hear it from an actual professional felt very like they were finally on my side, and not just dismissing it as, I don't know, maybe something in my head, or I don't know. But I felt such happiness. I felt relief. I knew that better things were coming. I felt sad. I felt anger. It was frustrating. I had a little cry in the doctor's office when I first found out because I just felt like it was so unfair that I spent my entire adult life dealing with this with zero answers, and how many other women are also going through life this way.
And Pam hits the nail on the head there, and I think so many women and men at home who have a debilitating or a mysterious disease that they just don't know what it is, when you finally get the answer, it is the relief it's immense. So what is your advice to women out there who are living in pain, who feel like they've been misdiagnosed? What is your advice to them if they have this chronic pain?
So I think it's important you need to advocate for yourself, and we have to denormalize periods as being really painful. So people are told, like, don't worry, this is just part of your period. It is not normal if you are debilitated every month. You're missing school, you're missing work, you curl up into a ball. It is not normal for over-the-counter medications to not be able to help you with your menstrual symptoms. So if it's intractable or Tylenol and ibuprofen aren't working, that's not normal for period pain. If you vomit or faint with your periods, that's not normal. If no matter what you're doing, you're not getting any relief from your symptoms with your menstrual cycles, and it comes back every month, and sometimes it persists through your entire menstrual cycle, through your month, that's not normal. You have to be able to say that this is not normal. A lot of women, the majority of women, though a lot of women have endometriosis, the majority of women get periods that come and go, and they feel absolutely nothing. They bleed. If they might have a cramp, it's manageable with things that are over the counter. This type of excruciating pain can't be normalized, and it has to be recognized as something that needs to be investigated further. We're getting better at it, but there's still a curve, and Pam is not alone.
No. All right. Dr. Dixon, thank you so much for your expertise. And Pam, thank you so much for sharing your story with us this morning here on TMS. Really appreciate it.
Thank you so much for having
and we'll
me.
be back after this.
This week on TMS, Chef Matt Basili dishes up touchdown-worthy Super Bowl snacks from Next Level Nacho Cheese Chili Dog.